Just who is supposed to pay for quarantine and treatment of Kenyans during this pandemic? Even as the government insists it is footing all the bills, Kenyans caught up in isolation centers continue to bear the burden as their hosts demand for payment before releasing them. Now, this financial burden seemingly a factor in many Kenyans avoiding testing and when picked up as contacts. Chemutai Goin as the details as the number of infections rose to 1,214 after 22 more people tested positive.
Effective today, government quarantine facilities will be occupied by those told to do so by the Ministry of Health. Will be given that facility free of charge. This is to facilitate those who may feel that they do not want to go for testing because of the cost of quarantine.
Despite the government clarifying repeatedly that it would settle the bills for those placed in mandatory quarantine in government facilities, including those isolated and treated in hospitals, confusion still reigns. Agnes, not her real name, was among 9 Kenyans who arrived from Dubai and placed in mandatory quarantine at the Kenya Medical Training College in Karen. On their arrival, the institution demanded upfront payment, but still admitted them.
She told us to just get into the rooms and then hatutalipa. Then 14 days later, we were tested on the 14th day, not on the 8th day, which we agreed to. And then on the 14th day, on Friday, she came back, the same lady, and told us that we were supposed to pay. So we started having a back and forth about it. And then she said that what information she had given us initially was wrong information and we were supposed to pay. Then she brought an assessor who she calls a social worker who took statements of people and they were trying to assess whether someone can be able to pay, can afford or not. Then one of the things the assessor told the people here was that the money wasn't for the government, it was for KMTC.
Tests were done and they turned negative. But when it came to the time they were to leave, the officials demanded payment.
So they were trying to negotiate with us. Wanasema, uko na pesa ngapi? Do you have like 5? Uko na 6K? Then eventually the news that we received now on Saturday morning when we were being released by the doctors was that the social worker said that we should pay half. So tukaleta vurugu. Their protests finally resulted in their release, but they say there is a lot of dirt behind the scenes. We are direct communication to people. Are they paying or not paying? Are they in government facilities or not? And is KMTC an agent of the government or is it not? Is it an independent entity?
These are bills charged to some individuals who had been held at the Kenyatta University Hospital. Some were on quarantine and then tested positive and received treatment. A number of them are detained at the facility for failing to settle the bill. This invoice shows the facility demanding an excess of 114,000 shillings from the patient. He was at the facility for 35 days. This other patient has been there for 38 days and was given a number of drugs for management of COVID-19. He has been slapped with a bill of 124,000 shillings. But according to the Ministry of Health,
for those who will be positive, together with their contacts, I want to remind and reassure the people of Kenya that the government shall meet the cost of treatment and quarantine.
The high cost for mandatory isolation and quarantine is also attributed to the low numbers of Kenyans seeking medical services across the country. Statistics shared by the department in recent days shows a sharp decline of hospital visitation at both public and private facilities. Meanwhile, 22 new infections were reported Sunday, pushing the total confirmed cases in Kenya to 1,214. 395 people have been discharged after returning negative results, while 51 people have succumbed to the novel coronavirus in the country. With life expected to limp back to normal in the coming weeks, the Ministry of Health is putting in place all the necessary measures to ensure that there isn't a spike in the number of infections when the new normal begins. Chemutai Goin, Citizen TV, Nairobi.